Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now we're going to look at the investigation of the epidemic. So what do you mean by investigation of the epidemic? First is we look at the steps. What are the steps which are involved? So under the steps, we look for the verification in case of diagnosis. So first is what you do, you verify. So verification of the diagnosis and then confirm the existence of the epidemic. So next you confirm of the existence. Next is what we do is we look for you define the population at risk. So the risk population is what you define it, that is you obtain a map in an area or the counting the population, or you can either do by counting. Next is there is a rapid search of all cases, so you do a rapid search. So how is this rapid search? By rapid search, we refer to the medical survey, the epidemiological case sheets, as well as the searching. So it can also include the case sheets. Next is what we do is we do data analysis. So data analysis on the basis of the time, place, person, and then the formulation of the hypothesis. So we form the hypothesis. Next is you test the hypothesis. So you test the hypothesis as well as the evaluation of the hypothesis is something which is done. And then you further investigate of the population at risk. Then you write your report. So final thing will be the writing the report. Now, when you look at the final epidemiological report, there are few things to look after. So the final report, what do you have? In case of the final report, you look for the background. Background includes the geography, climate, and demography, social groups. So you look for the BG, that is a background. So that can include the geography, climate. So it includes the geography, it includes the climate, demography, and socio-economic groups and health service organizations, as well as the normal disease prevalence. Next is moving on, we also need to know the historic data. The historic data including the previous occurrence of the epidemic and occurrence of any related diseases and discovery of the primary case in present outbreak. So the historic data. Then moving on, we need to know the methodology of the investigation. Methodology. So it includes the case definition, epidemiological questionnaires, the collection, as well as the laboratory techniques. Then we move on to the analysis of data. What do you mean by analysis of data? It includes the clinical and epidemiological data. So it includes the clinical and epidemiological data as well as the modes of transmission and the lab data. It includes the lab data as well as the other interpretations. Then lastly, we look at the controlling the measures. So you control the measures including the strategy definitions, methodology of implementation, evaluation methods. So you also do the evaluation methods and the prevention measures. To learn and grow daily like this, please do subscribe.